Welcome, everyone. We are covering the topic today of launching the National Medigap Plan Finder training for SHIP counselors. This is our second training for SHIP counselors. Today's event is a repeat of the February training, but many people may have wanted to hear it a second time just to get a few additional questions answered. So we have talked about the WebEx functionality. I want to mention that the majority of the questions today will be taken in the chat just because we have a large audience and we only have an hour. And I am one of your speakers today. I'm the one on the right, Jenny Paulson, the SHIP TA Center Director. Our primary speaker, however, is Brian Welch from CSG Actuarial. So you'll be hearing most from Brian today. I'll be giving an overview of this new tool, and then the majority of the time will be spent in a live demonstration from Brian on how to use the tool. And then we'll be taking your questions in chat primarily, and then I will talk about some of the resources and remind you about how to find the recording and such. So this tool is password protected, so you can only access it by logging into our password protected website. So our website address is on your slide. If you're a call-in user, it's www.shiptacenter.org, and you would click on the SHIP login orange padlock at the top, and then log in or register for an account if you don't have one. Wait for it to be approved, and then log in. There are 11 SHIPs who've been using this tool for a while. That's the last bullet on the slide here. And if you are in one of those 11 SHIPs, you would have already received information from a leader in your SHIP program or your SHIP director, and it may be that this tool is accessed in a password protected area that's specific to your state. We at the SHIP TA Center are really the messengers. We're paying for and housing this tool, but it's created, managed, and supported by CSG Actuarial. So Brian will be telling you more about the tool itself. It's available in all states in Washington, D.C., and plans are underway to get Guam, Puerto Rico, and the Virgin Islands added to the tool. So there are several benefits. We know that all states have Medigap information for Medicare eligible and Medicare enrolled persons and their caregivers and family members. A lot of the time it's going to be on paper, and maybe I know a lot of time goes into updating and perfecting these documents. One of the great benefits of this tool is that it's online and it's updated in real time with the latest plan information. So you don't have to rely on paper materials that may have become outdated. It also allows you to customize your searches by gender, age, tobacco status, and more. And it allows you to print the results and even email the results. And there are various options for how you want the printed results to look, which Brian's going to explain. So that, of course, is helpful because you will want to communicate the results with the beneficiaries. The tool is not an enrollment tool. It's really an informational tool. It allows you to sort through options and then again, filter them by criteria, but it stops short of being an enrollment tool. One of the factors is that it also displays future cost by unattained age for plans that are based on attained age. And then again, we're having this training webinar. We had one in February for counselors. We had an initial webinar for directors in February separate from that. But there's a help desk for this tool. There are training videos you can access when you're in the tool. So the support really is available on an as-needed basis at your convenience once you're in the tool. So it's been up and running since February 12th. So it's been there a while. Maybe you've already had a chance to view the tool. And so at this point, the next step really is to use it, but Brian is going to demonstrate how you go about using it. So now I'm going to pass the ball over to Brian, and he'll be sharing his screen.
Perfect. Thanks again. Sharing my screen now. So everybody should be able to see my screen. Again, my name is Brian Welch, and I work for a company called CSG Actuarial out of Omaha, Nebraska. And for those that have used our tool in the past with possibly their one of their states that we've worked with in previous years, this will kind of be a refresher or just kind of a not something new, but maybe something that the tool does that you're maybe not aware of that it has capabilities of doing. And for those that are brand new to this tool, this is really just an instructional way to show you the capabilities that you do have. And so the screen that you're seeing in front of you is the main screen that you'll get to when you get into the tool. And this is what we call our demographics page. And this is where you'll really type in the demographics of the individual that you'll be quoting for. And so I'll briefly go over each one of those pieces. The first is the zip code, and this will run any zip code in the country, any valid zip. So everything from Washington to Florida, from Maine to California, it'll run. And it'll give you the corresponding county and city and state that you're running it for. And so as you type in a zip code, it will pull back the corresponding area that zip code is attached to. You can then select the age, and we'll do any age under 65 all the way up to 99 plus. It'll provide you the exact quote for that particular age, gender, either male or female, and tobacco, either non-tobacco or tobacco. And the reason we ask for these pieces is where we do provide accurate quotes down to the exact demographics. So these are not going to give you quote ranges. It's going to give the exact price that a beneficiary would be eligible to enroll in. And the last is you'll be able to select your plan. So here's the different plans you can select. So if you'd rather see a high F, you'd rather see a high G, an N, an L, so forth, you'll be able to select those different types of plans. As you know, the pricing will vary based upon the plan. And then the effective date. And this tool is important, or this piece here is important because say you're having a beneficiary that's going to be enrolling, say, June 1st. You'll want to move that effective date out to a future date to make sure that, say, if rates are changing effective April 1st in that state for a particular company, you want to make sure you're looking at the most up-to-date rate changes or rate effective dates. And so that's what becomes important. And we do provide a warning just letting you know when you click effective date of stating exactly that. And the last piece here is household discount. We'll get into this here in a second. But you can automatically apply the household discounts to the rate if you want, right from this main page. So if you just right off the bat want to include that discount in there, we can go ahead and include that applied or not applied. And the last piece here is the client or quote label. Say you wanted to print this off, or you wanted to email this for Mr. John Smith, or you wanted to create a label associated with that printout or email. You can do so here under this client or quote label. This is optional, so it is not required to run the quote. It is optional. You can leave this blank if need be. But after you fill out these pieces, you go ahead and press Get Quote. And I went ahead and preloaded a quote for us. And so here are the results. And we've priced this out cheapest to most expensive. And we do show every company. So we're not representing any of these companies. We don't work for any of these companies. We're simply just providing non-biased information, priced out cheapest to most expensive, and it will show 100% of the market for open plans. And what I mean by open plans is we only show plans that are available for sale and that are currently marketed. There are companies in the insurance world that could be filing and approving new rates in your state, but they are not currently available for enrollment. And so those plans would not be available. This also includes any new entrants into the market. So if a company is entering your state or a brand new company has entered the market, say effective May 1st, we will go ahead and automatically include those companies on the tool. So there's nothing you have to do to make sure that you're refreshing the screen or anything like that. We go ahead and do all of that work for you guys. But for the results, you can see here we have all the different results or companies, and again, it's priced out cheapest to most expensive, so as you scroll through the list, the pricing gets more expensive. We'll give you the price per month and the company name, as well as the household discount and policy fee, and that's what we mean by HH discount. That's that household discount. This will be blank, or only one or none of them will show if it doesn't apply. There are certain states that don't have household discounts. There are certain companies in a state that don't have a policy fee. We blank. We'll only show this if it's available for that company in that state. This policy fee or application fee, as you may reference that to, is not included in this monthly cost. And so because it's not included in that monthly cost is because it's only a one-time fee. They do not pay that on a monthly basis. And so that's why we just display the fee and don't include it in the monthly rate. By extension, we'll also give some additional company information like parent company, if there's an AM Best or S&P rating, if there's a rating class, meaning if they have different tiers of rates associated with underwriting conditions or things like that, we'll provide the rating class, years in the market, and effective date of that rate, meaning when did that rate go into effect in that state. And so that's what we call our basic company level information there. And then below that, we have two different buttons. The first is the plan details, and this is going to go over all the benefits associated with that plan. So what the services that are covered, what Medicare pays, what this plan pays, and then what the beneficiary would pay in association with that plan. So as you quote different plans, this right-hand column here will adjust because certain plans pay for different things than the supplemental benefits, and different companies may have additional benefits associated with their plans. That will be available here under this plan details, which is also printable. You can view a printable button for here by clicking this view printable, and you can then attach it to an email. You can print it off if you wanted to provide this to the beneficiary along with the rates. We also have our company contact information, so if you're sitting down with the beneficiary and they want to go ahead and call that company to inquire more about enrolling, you can click this company contact information button here, and it just pulls up a PDF of all the different companies' contact information in alphabetical order. And so you can provide them that document if, in fact, they want to go ahead and contact that company directly. So that's our client, or I guess our company box here information. Above that, we have our quick quote section. And what this means is you can adjust anything we did on that initial screen there from this page. So let's say you wanted to look at a different plan, you wanted to change this from female to male, anything you want to adjust quickly, you can do so here on this page. You can also change the sort by. So if you'd rather see it in alphabetical order, or you wanted to see, say, by AM Best rating, that's really important to the beneficiary, they only run an A+ rated company, you can sort those results differently, but it will default by price. It will default to show you the sorting by price. If you do want to start brand new and fresh, you just want to start from the beginning, you can click this new button here up in the top right-hand corner, and that allows you to kind of start brand new from the previous screen that we were just on. On the left-hand side here is our toolbar, and this will do a number of different things, and I'll kind of start at the top. The first is compare quotes. And let's say I wanted to take 3 of these companies. We'll just select the first 3. All I have to do is click the company name, and it turns them green. And I wanted to compare these 3 different plans, or I want to do a cross plans. Maybe I want to compare a G to an N. All you have to do is click the company, it turns them green, and it's selected here on the left-hand side, all those 3 or 5 or 2 options that I've done. I can then just click Compare Quotes. It's going to load me a new screen with just those 3 companies on there. So maybe there are 3 particular options that a beneficiary is interested in, or there are 3 options that match the beneficiary's criteria of what they wanted to look at. You can just highlight those 3 companies, of which on the right-hand corner here can be exported to PDF. Say you were going to email these quotes to an individual, or print them off. Say the beneficiary wanted to take the printout with them. You can print this button. You can use the printer button here to print out exactly just these 3 carriers rather than the full company set. To go back to where we just were, you just click the back button, and it loads in then the previous screen that we had before. And then to uncompare those companies, you would just uncheck the company box associated with the compare, and it removes them from the upper left-hand corner. So that's our compare option, and again, that's to remove certain carriers from the full list, or if you wanted to do plan-to-plan comparisons, that's also available under that option. Below that, we have our export features. The first is going to be a blue print button, pretty self-explanatory. If you wanted to go ahead and print the results that are right on the screen here, you can. We have our red PDF button. If you wanted to attach it to an email or save it to your computer, you can click that red PDF button to do so. Or we have our green Excel feature, where if there's people that are using it that are more data-centric, they like to see just the raw data and wanted to dump it into an Excel database, we allow that option as well, clicking that green Excel option. Below that, we have 5 different adjust your view options, and the first is expanded or contracted view. And the green checkbox means that it's on, and if I were to unclick it, the green checkbox goes away, and it means that it's off. And what this expanded or contracted view does is it just shows a simpler view of the rates. So if you didn't want to confuse the beneficiary, or you just wanted to simply show them the price and the company name, that'll display on here for you. And you can print it this way, you can export it this way. It just shows a simpler view of the options. If the beneficiary just wanted to see price and company name, they can do so. But that's expanded view and contracted view. We also, the next one down is apply discounts, and as you hover over it, it will provide you kind of a definition of what you're looking at. Apply discounts is what it's going to do is just go ahead and apply this percentage discount to the rate. So it could be 7, 5%, 12%, 10%, whatever that household discount would be for those beneficiaries. You can click apply discount, and you can see the rates adjust, and the order of the companies may adjust. And so we went ahead and applied the discount. You'll see the new rate adjustment, and it has an asterisk next to the price letting you know that that price has been adjusted for the household. If you remember on our previous screen, when we typed in the demographics, you could include the household discount to be applied on the initial quote, and if you do that simply on the results page, this will automatically be checked. You won't have to check that. But you can always uncheck it as well, and you can see the pricing goes back to the original result. So let's apply discounts. The one below that is annual rate. Pretty self-explanatory. If you'd rather see the annual rate versus a monthly, you can do so here by showing the monthly cost. If you do have a beneficiary interested in the annual cost versus the monthly, you can show them those two variables. The fourth one down is kind of the most robust button and shows the most information, and that's our Market Analytics tab. And this is really going to show you 3 different things. The first is going to be age increase data, and this is going to be important for attained age policies. There could be people there could be states out there that are issue age or community rated. Arkansas is an example of that, where everything is community rated, and so for those states or examples, this will be blank. This does not apply to those individuals. This will be blank, or it does not apply to those companies or states. It will not show. It's only going to show for attained age policies, meaning each year the insured gets older, the company could be raising their costs just based upon their birthday. And we'll show you for each year, 66, 67, and so forth, what they'll pay in future years. So if you're dealing with the beneficiary and they say, well, I'm going to pay this price today, what could I expect next year? You can kind of answer that question. So that's age increase data. The next is increase history, and this is any time the company has filed new rates, what the date of change was, and the percentage of increase either up or down. And this goes back to 2010, which is when the government modernized the MedSup plans. Most companies will not go back that far for 2 reasons. One is we've had a lot of new entrants in the market since 2010, and they just haven't been in the market for that long. Or companies have entered new states and therefore don't have a increase or decrease history that goes back that far because they're newer in that state. Or lastly, they may be a company that has been in the market for a long time but have released their MedSup option under what we call a new paper or a new product line or a new company, and therefore that company does not go back as far as 2010. So many of the companies will not have an expansive rate increase history for that amount of time. Some do, but those would be the exception and not the rule. But you can see here for this Aetna plan in this zip code, and this is state and plan specific. So if I were to change the state or change the plan, this may be different. But for this plan and state, Aetna filed an increase, but they raised it 0%. They didn't touch the rate. So they filed new rates and didn't adjust it. If it was a 15% increase or 9% decrease, it would display that here under this increase history. And the last is the market data, and this is NAIC data. So the companies self-report this every year, and it updates every April. So for 2019 that just finished, you'll be able to see those results next month. And this is all self-reported. The company's reporting this, and it's giving you total lives insured. So how many total lives do they have on the books for MedSup? Earned premium, how much earned premium do they have or they've collected? Loss ratios, meaning how much did they pay out in claims on that earned premium. So for this example, they have an 80% loss ratio, meaning for every dollar they collect in claims, or for every dollar they collected in claims, they're paying out 80 cents, for every dollar they collected in premium, they're paying out 80 cents in claims. So it just gives you an indication of how much they're paying out in claims. And then market share. How much market share do they have for that particular plan and product? And this is both national and state. So that will vary. The state column here will vary depending on the state that you're looking at, but the national won't. All of this information may not be needed each time you're running a quote. Beneficiaries have different questions and different needs. We want to be able to provide you as much information as possible and allow you to decide what needs to be shared. We really view this as a market advisor tool, not just a quoting tool. That way you have as much information as possible and you can answer any question that would be thrown at you from a beneficiary. So that's our Market Analytics tab. And the last one down here is Select Plans. And these are not very popular. There are only a handful of companies that offer these, and they're not offered in every state. So it's possible if you were to click Select Plans that you would not find any Select Plans in the results. But if you are dealing with a company or you're in an area that offers select options and a beneficiary is interested in select options, meaning a Medicare supplement plan that has a network, you can include those select options in there. By default, we don't include them on there because, again, there are only a handful of companies that provide those results, and they're not popular. So that's Medicare select options. And so that's our adjust our view settings here, where you can adjust the view associated with the results that you're seeing here on the right-hand side. Below that, we have our health questions. And so let's say you're dealing with somebody outside their open enrollment period, and they wanted to be able to switch plans, and you wanted to not only provide costs associated with those options, but who actually would underwrite or insure those individuals. All you can do is you can search, or you can scroll through different health conditions, and let's say we'll select heart attack just because that's an easy one to relate to, and kind of a more popular option. I click heart attack here. It's now giving you the look-back period of 1 year, meaning if they've had a heart attack within the last year, they would have to answer yes on this application and therefore will probably get denied coverage. So we're giving you the option to select certain conditions and not just find the best company based upon cost, but actually who would accept that individual with their prior medical history. Again, this would only be applicable to people outside their open enrollment or guaranteed issue period. But we do allow that option there in the event that you are working with the beneficiary, say they're 75 years old, are just looking to enroll or switch that individual to a different plan, and they want to be able to find out, based upon those factors, who would work best. Below that option, we have our filter quotes here, and this really just filters the results on the right-hand side. Say you only wanted to see companies that contained a household discount, or you only wanted to see companies that didn't have a policy fee. You can simply just filter the results there that allow you to kind of quickly, weed out certain results if those two pieces are important to the beneficiary themselves. Below those options, we also have a few different other buttons. One is just the details page. Again, all that's going to do is pull up the plan details for the plan that we're looking at. Same thing with this plan details button here. We just put it in a different location. We also have an About Quote button. And what this does is it really just describes everything I just went over. So if you ever get stuck or you have questions, you can always watch this webinar again, or you can click this About Quote and it'll go over exactly what we just went over in more of a, some literature and exactly kind of explains and kind of little blurbs of exactly what we just went over. We also have this Contact Support button here. And what this does is it provides you a way, it gives our support line here. If you ever want to get stuck, you have questions that, you're having trouble getting in, you got an error message, you have a question on a rate, a certain company, anything at all, you can send us a message via email or you can call into our help desk and someone will get back with you in association with any question you may have. And again, that can range from everything from questions on the tool, if you're having trouble with the tool, and so forth. We get back to you pretty as fast as humanly possible, and we're here to help at the help desk as well if you want to call us and ask certain questions about that. Beyond that, that's really how you run a quote and display the information. A couple of other things in terms of some other questions that we've gotten in the past. This is mobile friendly, so as long as you have an internet connection, you can get access to this tool. So if you wanted to run this on your iPad or your phone, you can do so. As long as you have internet connection, you can get access to that. In terms of how we update this information, we get it direct from every carrier. So the carriers update this to us, and then we provide this in real time. So there's nothing you download to your computer. There's no update that you have to run like an app that you would have on your phone to make sure you're looking at the most updated information. This is all updated in real time as the companies file and approve, as well as release. That's an important piece on there. They may approve rates, but not release them for a few months. As soon as they're released to the market, they'll get loaded onto this tool here. And so that's what we do on our end, is we work with the carriers to make sure that everything is up to date and accurate for you. And so that's the tool. I know Jenny wanted to has a few more slides, and then I know there's certain questions and anything we wanted to go over. But Jenny, I think I'll pass it over to you, and we can start that process.
Okay, thank you, Brian.
Yep.
So I will see if I can take the ball. If you just want to pass me the ball, that will automatically end your sharing, or you can just stop sharing at the top. There you go. Thank you. And then maybe the WebEx host could just pass me the ball, or Brian, just right-click on my name and pass the ball. Thank you. So we are at the Q&A. I do want to give you a chance for your questions, but we've experienced in the past that sometimes the questions are about resources. So I'm going to quickly go over the resources and then come back to the Q&A. So this is the PowerPoint we used in February. So we actually, on the third bullet here, we are experiencing the second training webinar. Today is March 4th. We have a feature on our website that's depicted on this slide. When you log into our website, you will see that feature. It has a link directly to the tool. We also have on the features page a quick link to the tool, and then it's one of the menu items in the main menu, Medicare and Other Insurance. So if you want to find it that way, here is what it looks like. You would just click on Medicare and Other Insurance, and then at the bottom you see Medigap Plan Finder. You just click there and you can easily access the tool. And again, we do have a contact slide so that you can remember how to contact CSG Actuarial. You would contact our National Technical Assistance Center if you don't have an account to log into our website or have any difficulty accessing the tool once you're on our website. So our contact information is there as well. So I will go back to the Q&A slide. Here's how you ask your question. I know a lot of you have already chatted questions. And so Sue Choplin, our Center's training coordinator, is going to ask Brian the questions that you have already chatted. So I'm going to hand things over to Sue.
All right. Thank you, Jenny. And just to let you know, there is already a recording in the resource library from that event last week that Jenny mentioned. Today's recording will be in there tomorrow, so you can listen to the one you listened to today, or if you have questions, you can listen to last week's. I do see that Jenny answered some questions in chat already to everyone, so if you asked a question and we don't get to it with Brian today, do look back at the chat because it's possible that Jenny may have answered that. So one of the questions that came up, well, first off, can you, Brian, tell us what NAIC stands for? It's a quick, easy one that was something that people questioned.
Yeah, sure. It's the National Association of Insurance Commissioners. And that's just a commission that handles the financial reporting for the companies. So the companies report to the commission, which is the NAIC, and then they provide us those financial figures that you see there on under that market analytics tab.
All right, thank you. One of the other things is, just for clarification, that if somebody is searching for a client, it's based on that client's zip code or state, not the counselor's, correct?
Yes, it would be that client's zip code, or you would pull the zip code of the address of the individual that you're running the quote for, and that would match the rate to where they lived.
Right. Okay, and then maybe a little bit more difficult one here is we've got some questions about silver sneakers. Would you be able to share your screen and show how someone would be able to see that? I know you did that last week, so apparently there's a few other people that wonder about that.
Yeah, it's under the Plan Details tab. So if you remember, we clicked that Plan Details that show all the benefits associated with each of the plans. Any of the benefits with those plans would be under that Plan Details button for each one of the companies.
Okay. And then why are C&F available supplemental plan options when choosing what type of plan you want?
So they're probably speaking to macro rules. And so just for a little background, the government updated what they called MACRA, meaning they were getting rid of C&F associated with the tools. The reason we still have them in there is if you were 65 prior to 1/1/2020, you're still eligible for those tools. And we have a disclaimer on the site that outlines that rule for the SHIP counselors. Eventually, we'll remove it off because there'll become a time where nobody's signing up for MedSup insurance who would have been 65 prior to 1/1. But because we're so close to that 1/1 date, many people are still eligible for those plans, which is why we still include them on there.
All right, thank you. This is kind of a comment, but maybe you can answer it a little bit. When I did this, quotes were different than what my client received directly from the carrier.
Say that again, I'm sorry.
They're stating when I did this, the quotes were different than what my client received directly from the carrier.
Sure. So there could be a number of different factors for that. One is the effective date. We run into that a lot where, say, Humana was updating rates starting 3/1, and the quote that was provided to the tool you did as of 2/27, and therefore the rate that's getting back from the carrier is the 3/1 rate versus the 2/27 rate. We see that a lot. It also could be due to the fact that if they are getting bumped up due to their enrollment status. So, for example, if they're outside their GI period and they're moving to a higher rating class or tier, that could also be a possibility. There could also be a factor to where the different companies have different papers associated with their rates. So Humana is an example where they have both an Achieve and a Value plan, essentially two plans in the same state where a counselor could have provided a value option and the company provided the Achieve option as well. That could be an option or a factor as well. So there could be different scenarios associated with those plans. If at any point in time you have questions on the rate that you're getting or have follow-up questions associated with any of the information or rates, you can always click that contact us button and submit that question in. And we can get an exact response based upon an individual's case. All
right. Can you compare a Plan G to a Plan F for the same company?
You can. So you can do a Plan G and a Plan F using that compare option or compare feature on the tool. So if you wanted to do a side-by-side of a Plan F to a Plan G on the platform, you can do so right on the tool by using that compare feature.
All right. And can you explain the household discount?
Sure, absolutely. Household discount can apply to really two reasons or two scenarios. One is companies allow for a discount if spouses are signing up together. So they'll provide a 7% or a 5% or 12% or whatever the percent discount would be to beneficiaries if they're getting two applications sent in, so they'll provide them a discount. The second there are some companies that are more lax with the rules, and they could say, okay, if you're signing up for, a 65-year-old is signing up for an Aetna plan, we'll provide the household discount if they have somebody in their household that is 21 years or older living with them. But that's really the two scenarios where the household discount would come into play.
All right, thank you. And then is this tool ever going to be available to the general public or to insurance agents?
Sure. So right today, and Jenny might be able to speak on this more, today it's not offered to the public form. It's behind a password-protected tool, and it's not available for public sourcing as of today.
Yes, this is Jenny. We're paying for this tool with supplemental funding from the Administration for Community Living, and the criteria for doing that means that we have to keep it password protected just for SHIP counseling.
All right. And they also asked about insurance agents. I'll let you answer that.
Sure. Insurance agents could have access to this tool. That's the origination of the tool itself, is really how we started working with different SHIP offices. And so it is possible that insurance agents would have this information either from us or from the companies themselves.
All right. Somebody wants clarification real time. So if a carrier updates premiums, do you update them on the same day?
Sure. So we would update them, and that's a good question. A carrier will file rates with the state, and then they'll be approved. So let's say I'm carrier ABC, and I file new rates in the state of Nebraska, and they're approved, and then I'm going to release them for sale starting July 1st. We would not put them in today because they're not releasing them until July 1st. We would normally put them in about 30 days-ish before they would go into marketed or before they would go into circulation is when we would load them in. The reason we do that is because we don't want to quote somebody today for a new rate if that's not eligible yet for them yet. And so the carriers work with us on when they start to go into circulation or when they would want beneficiaries to start being quoted those new costs.
All right. Can you talk a little about the accuracy of the quotes? We've got a few questions kind of leaning that way.
Sure, absolutely. So we get, kind of speaking on my previous point, we get all the rates directly from the insurance carriers, and so the carriers provide us the rates as they approve them and update them. The carriers do vet the rates. The carriers do audit us to make sure that we're providing accurate information. It's beneficial for them to do that because these rates are going to directly affect the business that they sell and write with their beneficiaries that they work with. And so the accuracy of the rates should be 100%. Just due to the fact that they are providing it directly to us. We're not going to a third party, and that they are auditing the rates that they provide. That doesn't mean that there isn't one-off or two-off cases where we'll find something that the carrier screwed up and provided us something that's inaccurate, but that's the exception, not the rule. And again, if you have any questions on rates, and we've gotten some in the past, and we've gotten some in the previous years, we worked with some different states. We're really good about providing explanations on any rates that you were getting, and you can click that Contact Us button with any of those questions as you use the tool.
All right. Can you talk about states that don't have the alpha system, like Minnesota?
Yes, that's a great point. And if I want me to share my screen again, I can go and show that again.
Sure. Let me. Actually, Brandon, can you pass him the ball, please?
Perfect. Let me share my screen here. So that's a very good question. So Minnesota and Wisconsin are what we'll call rider states. And what that means is they don't have Plan F or Plan N or Plan G. They have what we call base options. So you can see here I typed in a Wisconsin zip code, and the plan is now switched to Wisconsin base. I'll go ahead and run this search here. What this is going to do is pull up the base options associated with the plans. I can then select my rider. So if I wanted to add in this 50% Part A deduction rider, I can, and then it adjusts the cost associated with my rider selections. So that's how we handle those states that are a little different.
All right. As long as you're in there, somebody would actually like to see you compare different letter plans.
Sure. We'll go ahead and run a letter plan for you here. So go ahead and press Get Quote. I just use my quick quote section here just as we went over before. Okay, so let's say I wanted to compare this Plan A by United Healthcare, and I also want to do a Plan G by United Healthcare, or whatever combination you wanted to do. I'll just go ahead and click the company. I then highlights it in green. It means I've made that selection as a compare option. I can then switch over to G. It'll automatically run the quote for me. I'll get the results to pull up, and I'll find United Healthcare on here again. Here's my Plan G for United Healthcare. I then select it just as I did before, green. Now my Plan A and Plan G are here up in the top left-hand corner. Again, you could do any combination. It doesn't have to be the same company or the same plan. I then press Compare Quotes. It's now going to put my Plan A on the left-hand side and my Plan G on the right-hand side to allow me to do the comparisons across plans.
All right. Will it indicate if a plan is open to members in a group such as ARP?
Sure. So that really only pertains to AARP. We do label the AARP label in the quote, so we do let them know that this is an AARP plan in the name. So we do indicate that you have to be part of AARP to be associated with the group. But that's really the only group association plan on the tool. But like I said, we do include the AARP name within the company.
All right. What is Universal Compare Quotes?
Sure, that's the same thing. So it's the same button. It does the same options as what we're talking about here. So it's just duplication of the compare.
Okay. And do all companies provide their rates to you?
Yes, that's correct. We get all the rates direct from every company. We have 100% of the market. Again, we're non-biased, so we don't represent any of these carriers. We're not insurance. We're not, us personally, are not insurance entities. We don't sell insurance. We're not a licensed insurance agency. So that allows us to be to present everybody in a non-biased function.
Very good. And so if it only displays plans that are open to them, correct?
Yes, correct. Yeah, it's what we call open block. There are companies out there that are what we call closed block, where they still have a Medicare supplement insurance plan, but it's not available for new business or new enrollees. It only exists because of the existing pool of people that were in it before they closed it off. Those would not be displayed on this tool.
All right. And the last typed question I have here is, how can we best use this with disabled clients?
Sure. So if you're dealing with somebody under 65 that is trying to enroll in a disabled plan, you'll do that here on this age button here. So you can go down and it says 64 disabled or ESRD. You would just select that as your age selection, and it'll pull back results if available. Some states don't require it to offer disabled plans, but for the states that do and the companies that offer it, some states require that. You can pull those plans by doing that comparison.
All right, and it looks like Patricia maybe has a question for us. Brandon, can you unmute Patricia Richardson's line?
Sure, just one moment.
Thank you.
All right, Patricia, you're now unmuted.
Hi, I didn't realize I had my hand up. I was just wondering if the connection was going to be made to a local broker, or will all inquiries be referred to a national company?
I think your probably question is if you had somebody beneficiary looking to enroll, if you would refer them to an agent or just to the company directly. That's really up to the counselor, and some other people on the SHIP TA Center might be able to have a better response. This tool is not going to put you in connection with anybody in terms of an enrollment feature from an agent perspective. but we do provide the direct company contact information if need be.
So the company contact information is to the national company? I guess that's what I was asking about.
Yes, that's direct to the company. Yes, that's not going to any insurance brokerage that would represent that insurance carrier.
Okay. Thank you.
Thank you, Patricia. And then can you reiterate the benefit of using this tool versus using paper guides?
Sure. The paper guides, and this is really how we got started working with different ship offices. We were contacted by our home state, Nebraska, because they were using paper guides for different insurance quoting. And essentially what a lot of states have done, as we've learned over the years, is they'll come out with a paper guide starting 1/1 of 2020, and that provides some ranges or some quotes for a specific age and plan for an individual. For those that kind of understand the market or have been in it a while, know that it updates pretty regularly. And so after a month or two, that paper comparison that the state would use to do adjustments would be old, would no longer be valid. And so that's kind of why we started to work with other states, is because they may be quoting somebody March 1st with January 1 data, and it's much different than what it was back in January. And so that's really kind of the antithesis of why we've started to work with the ship states way back when.
All right, thank you. So I don't show any new questions. If somebody has some, please feel free to chat them or raise your hand. In the meantime, Brian, if you want to stop sharing your screen, you're welcome to. Brandon,
Okay.
Could you bring those file transfers back up, please? So anybody who didn't have an opportunity before we started, if you want to download the PowerPoint and these resources, there's going to be a file transfer box. It's going to pop up on your screen. You're welcome to download them at this time. There will also be a participation certificate, so if you need to prove that you took this training, you're welcome to download that also. If you don't see the file transfer box on your screen, it's because of a WebEx compatibility issue, and so what you're going to need to do is go log into our resource library. All of these resources are in that library, and today's recording will be in by tomorrow, so you'll be able to access it another way. You just won't be able to get it right now. And it does look like maybe we have another chat here. Looks like a fantastic tool, correct? And actually there were several comments previously of other people who are excited about this. We're excited too, so we're glad that you are also. Here's one. How do you email a quote? Is there a button that we can do that or download the quote?
Yes, so that's that PDF export that I mentioned. They have that red PDF button for any of the different comparisons or benefits or rate information. That PDF can be attached to any email. So if you wanted to email the quote to any individual, you can certainly do so.
Fantastic. Do companies let you know when they are going to stop writing new policies, and when do you remove those rates from the tool?
Sure. Yes, the companies do let us know when they either A, have exited the market, B, have exited a state, or C, have exited a state and then reintroduced a new product. And that the third one there is the most popular. Well, they'll cut off an old, what we call paper, introduce a new company under a new rate. The companies do notify us of that. For a company that's completely just pulling out of the state or completely just closing off their block, we'll pull it out the last day or the last month of removal. So if they say February, we're no longer going to allow applications to be submitted under this product, we'll remove it in the month of February.
All right. There's a question about pre-existing conditions, but I think you already covered that with clicking on the heart attack button, so that is something that can be taken into account, but I do see a few questions about that. So I don't know if you want to address that anymore. Are there other pre-existing conditions that would show up besides kind of those standard ones?
Yeah, so how we pull those conditions is it comes directly off the applications. So any condition that would be asked about on the applications themselves is how we create the conditions field. And so there shouldn't be any on there that are not currently asked. Now, not every company asks about all those conditions, right? You may click a condition and under the box it may say not currently on the application, or not currently asked about, or not applicable. That's very, the reason I use heart attack is pretty much everybody asks about heart attack, but that's how we create those condition look-back periods.
All right. And one other question, then I'm going to have Jenny answer a question that's on here. But first, if a company has innovative benefits, where would that information show up?
Sure. So we'll label the innovative option under that rating class field that I mentioned in the company box. So if it is in what we call an innovative plan, it will be labeled under the rating class option within each company. Innovative plans are becoming more popular. But most companies do not offer innovative benefits, so don't be surprised if you're looking at a company or a grouping of companies that don't have innovative on there. That's just because they haven't introduced those yet.
All right. Jenny, did you want to go ahead and speak to that question that was chatted?
Yes, it was a question about using the tool to help with enrollment, and we do not have plans to add a feature to the plan, to the tool for enrollment. It's an informational tool only, so I just wanted to reiterate that we're not paying to add an enrollment function. I don't know if that would even be possible. That would be for Brian to answer, but through our SHIP Center grant funds, that's not part of the plan.
Yeah, and to speak more about that, the reason we didn't include any enrollment stuff on here is because if you wanted to go ahead and enroll the individual for a certain company, the companies are going to require a national producer number or a writing number that's normally meant for an agent to submit that application in. Any applicant that will be enrolling themselves outside of an agent would have to do it direct with the insurance carrier. And because the SHIP counselors are not agents themselves, or at least I don't believe they are, that will be the reason as to why it's not on there.
All right. How can you list a loss ratio for an HDG plan?
Sure. So new plans that would enter the market, and that brings up a good topic. New plans that enter the market, there would not be a loss ratio with it because they're brand new and probably haven't filed with the commission on loss ratios. So you'll see an NA with those. You also see NA under companies that were new. So let's say a company is brand new to the market for 2020, or they're brand new as of November of last year. Many of those companies are not going to report because there's not enough data there to report anything, and so they'll say NA under that market analytics tab.
All right, one more question, more kind of clarification on pre-existing conditions. Does it state how long the pre-existing conditions would apply? Because they may still be able to obtain the policy, but be subject to the pre-existing condition. Sure.
So the look-back periods do have a date associated with it. So it'll provide you a year, 2 years, ever, 5 years, not applicable. So that'll be on there. We do also in the rating classes. I mentioned that in the webinar. The rating classes will have the different tiers of options or rates. So United Healthcare has standard, level 1, and level 2. We do label those of which tier or rating class you're looking at. Most companies do not have rating classes. So again, don't be concerned if you're looking at a grouping of carriers and none of them have rating classes. Most of them do not provide those, at least not up to this point. But we do handle that for those cases that may occur.
Okay, and I'm not quite sure about this question. It just says ours doesn't show NA, and I don't know if this was added on to another question. Does that make sense to you, Brian?
Can you ask the question again?
Ours doesn't show NA. So the person who chatted that, if you could chat more detail if Brian doesn't understand what that means either.
Yeah, and they could be referring to something in terms of the data or the NAIC data. If it doesn't show
NA, the HDG plans.
Oh, okay.
Sure.
Thank you.
Sure. Yeah. So in terms of if it's showing data or showing enrollments, that means they've reported it. And if it's not showing data or it's just blank, that means that they haven't reported them.
Okay. All right, and it looks like this person maybe wants more clarification after we're done with the webinar. So if there are any other questions, now's the time to get them out there. We've got about 4 minutes left. We want to make sure and answer any questions you might have, but we're also not going to keep you over your time. So now would be a good opportunity to ask those questions. Okay, so here's one. Can you comment if states who offer plans to below 65 made changes to ensure people have access to Plan D instead of Plan C?
Sure. So the tool will only show plans that are available to beneficiaries. So under that example or any example, if they were to quote an age or an estate or a plan that a company does not offer, it would not show. Same example, if there are certain state rules where they offer under 65 or disabled plans but only under Plan A, it would only show under Plan A and not under Plan F or any other plan selection. So the system will automatically filter. And that brings up another good point that if you're quoting a Plan G and you switch to Plan N and you're trying to find the same company you quoted for Plan G and you can't find them in the N or whatever combination may exist under that scenario, that would be because that company doesn't offer that plan.
Fantastic. So if anybody does want to download the transcript from today, you do need to do that before you close out that closed captioning box. There is a place there so you can download it and save it. Otherwise, you won't have access to it again. We don't save that after the events are over. Again, we just have a few minutes left. Oh, some more questions. Why are age increase percentages different from increase history percentages?
Sure. So increased history is when they filed new rates, when they physically went to the Department of Insurance and filed a new rate increase overall for their entire block in that state. Age increase data is when they're just raising rates based upon the individual getting older. And so they don't have to file those increases with the state. They're simply just saying, hey, you turned 66 this year, here's your new rate. We didn't file new rates or change the rates, but it's based upon your attained age status of your policy.
All right. One more question here. Let's say someone has a guarantee issue, for example, new to Part B, but some companies, while having to accept them, may have a waiting period for pre-existing conditions. Do you show this information?
Can you say that again? I'm sorry, you were cutting out.
Oh, I'm sorry, you bet. Let's say someone has a guarantee issue, for example, new to Part B, but some companies, while having to accept them, may have a waiting period for pre-existing conditions. Do you show this information? Sure.
So in terms of a waiting period, that would be associated with the underwriting drop-downs or conditions that would be on that drop-down. So that would be part of the underwriting conditions on the page.
All right. I do not show any other new questions. We only have a minute left, so what I'm going to do is say that we appreciate everybody joining us today. Again, real briefly, we'll have the recording from today's event on the resource library by tomorrow. However, there is already one from last week on there, so if you do need to go back and re-listen to something, most of this information is on that recording from last week, some very similar questions to what you guys had today. Again, thank you so much, and you guys have a great day. For that one person that wanted a little bit more information, if you want to stick around, we'll go ahead and let you talk to Brian for a moment. Otherwise, the rest of you are welcome to go. Have a great day.